Should prescription medications be covered for everybody? I'm an ER doctor, and every single shift I see someone who's come in with a medical condition that could have been prevented because they can't afford their medications. So let me give you some examples. I often have patients coming in with diabetes and complications from their diabetes, so things like diabetic ketoacidosis, because they haven't been able to afford their insulin. They end up having severely high blood sugars and come in with an essentially life-threatening condition that could have been prevented. I also often have patients come in with asthma or COPD exacerbations that, again, could have been prevented because they can't afford their puffers. They've been kind of trying to ration them. They haven't been able to afford their steroid puffers, which are preventative. And then they end up coming in with worsening oxygen requirements and end up needing to be admitted to hospital. I've also seen patients who come in with heart attacks and strokes who have not been taking things like statins for their cholesterol, blood pressure medications, things like aspirin, which all have really good evidence behind them to prevent these conditions because they couldn't afford them. So my answer is yes, I do think medications should be covered for everybody. The return on investment is huge. It would prevent so many hospital visits and actually improve the lives and longevity of so many people. Let me know what your thoughts are in the caption, and if you've ever run into any issues with not being able to afford medications and any health outcomes that are negative that you've had because of it. Thanks for tuning in today. Until next time, take care.
For those of you that hate healthcare in America, you're not alone. I think most people probably hate the healthcare. But how do we fix it? Do we make it a human right and give healthcare free to everyone? That sounds expensive though, because free isn't really free. Someone's got to pay for it. But our current system's not really working right because it's super expensive for people. You got to pay money so that you can still pay money. But after you've paid a certain amount of money, you get to pay slightly less money as long as you go to the right hospital. So that doesn't sound sustainable either. And then you look at other places like Canada, where they do have access to care through a nationalized system, but then you get a bogged down healthcare system that is overloaded. They have so many patients, which is a good thing, right? It's a good problem to have. But then there's wait lines, and then you get a denial to access to care based off of just the time frame to get in, which can actually also be a problem in America too. So not only do we have to pay, but then we also might have an access to problem due to location, cost, and wait times as well. I don't know what the answers are, but if you guys tell me what the answers are, I'll try and help make it happen somehow. I don't know. I know that anyone watching this video agrees, we want people to live longer, happier, healthier lives, right? We can all agree there. How do we do that?
If I trip right now and bust my head open, I could practically lose my entire savings. 15 to 30,000 is how much it costs to give birth to a child here in the United States. Stitches can cost $500 to over $5,000. There was a man in Tennessee that had to pay like $6,500 for 4 stitches. Because of how much healthcare is, this year I maxed out my FSA to $3,300 in January. Between January and now, June, so 6 months, I've already used all of that on copays, medical bills, and other medical expenses. We always say this, that healthcare shouldn't be a luxury, but a right. Clearly, that's not the case here in the US. Instead, our leaders in government keep pouring millions of dollars into wars, genocide, and ICE goons. So I don't know about y'all, but I'm fed up, especially having been at Delaney Hall this last week and seeing that these people are only able to do what they do because our government took money away from our healthcare, which is just evidence that, again, our healthcare system is so broken, which is why I'm joining the fight to get healthcare right. Because y'all, I can't afford this. I think you should too. There's this awesome new campaign called One Nation Overcharged, which is about not just highlighting the stories of how our healthcare system is so broken, but also what we can do about it.
So my left ear has been hurting and been bothering me, and yet I've been trying to take care of it on my own without going to see a doctor. But finally I bit the bullet, making an appointment for tomorrow to go see somebody to find out what's wrong with it. But in the back of my mind, it's not even like caring about what's wrong with it. It's more, how much is this going to cost me? And this is the reality of living in the United States as an American without medical care. We have to think about the costs associated with a disease, because we're literally one disease or one cancer away from being bankrupt. You can go online and search for yourself. You can see how many Americans are begging for donations to pay for their medical bills. People keep saying we have the best healthcare system, the best doctors. What good is the best healthcare system or doctors if you can't pay for it? We a lot of times don't even want to know what's wrong with us because we can't afford to know what's wrong with us. If this is your reality too and you have stories to tell, please comment down below and let me know.
The US cannot afford to pay for your healthcare. We cannot. It is way too expensive, and the amount of money it would cost our GDP, the amount of money it would cost our government to pay for your healthcare is too much. So therefore, we do not have enough money to pay for your healthcare. We do have enough money to start a war and bomb hospitals, but we do not have enough money to give you good quality healthcare across the board. We don't have enough money to pay for the homeless. We don't have enough money to help those who are poor, simply because, again, it would be way too expensive for our economy, and our economy would crumble because we just can't handle that. We do have enough money to bomb the poor and the homeless, but we cannot pay to support our own homeless population. And honestly, when it comes down to education, don't even get me started. As a doctor, I can tell you firsthand that we as a country do not have enough money to pay for the finances and to give everybody a good, meaningful education across the board, not just elementary school, but even for college. There's no way we can support that. We do have enough money to bomb schools, especially girls' schools. We have that much money, but we cannot do anything for you.
Americans can't afford to get sick. That's what our healthcare system feels like for so many families right now. Brenda in Goodyear reached out to me about the rising cost of healthcare. She's not alone. People all across Arizona and our country are stressed about rising premiums, prescriptions, surprise bills, whether or not they can afford to use the insurance they already pay for. Healthcare is a human right. We must move toward universal healthcare. And that starts with a strong public option that gives people affordable coverage and real choices. If you believe we need universal healthcare, follow this campaign.
You know why healthcare will never be free in America? It's because they already know that a large percentage of Americans at some point in their life are going to become chronically ill based on the ingredients they are putting in our food. Our bread has 45 ingredients in it. It should take no more than 3 to make bread. Our shampoos, our conditioners, our deodorants, our beauty products, skincare, all full of things that are known, scientifically proven to disrupt your hormones, damage your cells, do terrible things to your body. So why would they ever make healthcare free when they know that they're guaranteed to make a shit ton of money off you at some point in your life? It's just hilarious to me that we'll blame it on everything around us except the thing we do every single day, which is put deodorant on, shower, and you guessed it, eat. We eat every day. The term "you are what you eat" is literal. It's a literal thing.
Am I the only one with dental anxiety so bad that they literally have to fucking sedate me just to touch my mouth? Because this is horrible, it's inconvenient, and dental work is so expensive. I don't understand how lower income people are able to get dental care. Like, they just don't. I make really decent money and I cannot afford what's about to have to be done to my mouth. I've had so much work done back when I was under my dad's insurance. I've had work done earlier, so much work done. And now that I'm on a marketplace plan, they don't cover anything. Literally nothing. 95% I have to pay for. 95. I actually don't know what I'm going to do. When I say it is thousands, like thousands, yes, thousands and thousands and thousands. And I'm just stressing out. I hate the dentist already. I have severe dental PTSD, and the only way I can do it is with IV sedation. And the IV sedation alone is $1,000 minimum, not counting the crowns that are about $2,000 a piece, not counting the root canals. I mean, I'm looking at probably 12 grand. I don't know what I'm going to do. I mean, I'm going to figure it out. It's just extremely stressful. I wish I didn't have dental anxiety. None of this would be happening. And I'm literally holding myself back from crying just from them x-raying my mouth. So I'm just over it. Fuck.
There has been some huge news in the world of medicine and healthcare. And if we're looking at starting off with the new Gallup poll that found that many Americans now suggest that healthcare is simply unaffordable, and they're finding difficulty paying for basic things like prescriptions and overall healthcare deductibles, with nearly half of Americans saying so, which is significantly worse compared to the 56% in 2021. The Ebola outbreak in the Democratic Republic of Congo continues to go crazy, with over 1,000 people who have tested positive and nearly 35,000 people who are expected to have been in contact with someone who tested positive. There's still only about 250 dead, unfortunately, but it doesn't seem like the numbers are planning on calming down anytime soon. And lastly, the FDA has announced a new trial called Trailblazer in hopes to speed up the amount of time it takes to get drugs approved by the FDA. Part of it is making it so that you can get in contact with researchers for primary and clinical trials in a lot faster of a manner, as well as making it easier for people to get access towards resources from the FDA that explain what is required in order to get things approved. If you want a breakdown of more of this stuff, I do a Substack post each day. It's free for anyone if they want to check it out. You can find the link in the bio for that.
Good morning. I haven't even brushed my teeth this morning. I gotta stop looking at this phone first thing in the morning. I saw this on the toilet on my phone this morning, and I had to come outside and get some fresh air and some sunlight on my skin. Put my feet in the grass. This is from me getting bit by a dog. This right here cost me this what they did, allegedly. They cleaned my wound with alcohol, tried to stick a Band-Aid on it. It wouldn't stick, and they said, oh well, you can try when you get home if you have some Band-Aids. They gave me a tetanus shot, a big ibuprofen pill, and one antibiotic pill, and then sent in a prescription to my pharmacy that I paid for, even though it was $706.
When I saw the termination notice come in, it was kind of nerve-wracking.
James DiGilio is 62 years old. He couldn't pay for his health insurance after costs skyrocketed.
I was paying last year $57 a month premium, and then it jumped up this year to $16.90 a month. When I first saw it, I was surprised. I thought this was a mistake.
Millions of people, like James, saw their insurance premiums soar in January after the Senate deadlocked on competing proposals, leaving the expanded tax subsidies to expire. James relies on medication to manage his blood pressure, cholesterol, and diabetes. Since losing his insurance, he started rationing his medication.
I was concerned about the medications, not knowing how I was going to refill them. Because I figure if I could stretch it out and not take them for a week or so, then that's another week I could tack on that I could still stretch it out to.
James works at a pizza restaurant, making $14 an hour washing dishes and delivering food. That brings in, on average, $1,200 a month plus tips. He says that the $1,690 health insurance payment would eat up all the income from his job.
It would have been very hard to manage to pay that much premium for health insurance.
He takes care of his sister, who is currently unemployed. In January, to cover their expenses, James took out his Social Security retirement benefits early. If he had paid for his new health insurance premium, on top of his other expenses, that would have left him nearly $1,400 in debt at the end of each month. For years, Florida has been leading the nation in Affordable Care Act enrollment. 1 in 5 residents are enrolled in an ACA plan, compared to 1 in 15 nationwide. And 98% of Florida's enrollees relied on federal financial assistance to pay for a plan. Now, many are facing a future without health insurance. More than 1 million people nationwide have dropped their coverage since the ACA subsidies expired. Today, with only a week and a half of medication left, James is visiting a free clinic nearby to see if they have the medications he needs.
Okay, if you just take a seat and I'll tell the nurse you're here.
Jimmy's case is not unique. All of our new patients who had insurance and now do not have insurance have all seen tremendous increase in their monthly premiums to the point that they can't afford them any longer.
Terry Balletto runs this volunteer-based clinic in Bunnell, a city in northeast Florida. It relies on private donations and grants for its funding. She says her clinic has seen a surge in patients over the past 3 months.
This is the largest increase in patients that we've seen in the 12 years that I've been here. If we're not in crisis mode in healthcare in the United States, we're almost there.
So was it 2 months from now, you said? Yes.
For James, a measure of relief. Today, the clinic refilled over a month of medication for free. The clinic may have met his immediate healthcare needs, but what worries James is where to go for anything more serious and how he'd pay for it.
If I had affordable health care, my life would be easier. It would be more relaxed. and I could, not have to be stressed about the insurance and hopefully also medications.